Good morning, everyone. Welcome to CAMH. I'm Dr. Catherine Zahn, President and CEO of CAMH, Canada's foremost mental health teaching hospital and a world-leading research centre in the field. This is a special day at CAMH as we officially open the third phase of our historic redevelopment. We're standing in the reality of a bold vision come to life, respectful and dignified spaces that support the best in crisis and complex mental health care. As well, they integrate CAMH with our community. Thank you, Premier and Ministers, for investing in this wonderful transformation. We've made progress, but the unmet need for mental health care seems infinite, and the pandemic exposed inequities that have existed for centuries. I personally commit to work with government alongside my mental health sector partners to do better for the people we serve, toward a world where everyone recognizes that mental health is health. And now it's my pleasure to introduce Premier Doug Ford. Thank you. Premier Ford.
Well, thank you very much, Dr. Zahn, and the great team here at CAMH. Folks, before we get to today's announcement, I'd like to make something very clear. That this Thanksgiving, we're asking that you spend the holiday with just your household. That means sitting down to dinner with only the people you live with. And yesterday I spoke with my wife Carla, and that's exactly what we'll be doing. I know it's tough on everyone. It's tough not to sit down with in my case, all my girls, but our family is no different than anyone else, and we're all going to make sacrifices to stop the spread of COVID-19. And if you're alone, you can pair up with one other household, but only one. And as much as possible, please limit the amount of people you're getting close to. Thanksgiving is normally a time when people get together with family and friends, but these aren't normal times. In the United States on the 4th of July and here at home on the civic holiday and Labor Day, we saw people relax, we saw them let their guard down, and as a result, we saw the numbers spike in the cases and contacts. So for this Thanksgiving weekend, it's not enough just to limit the size of our gatherings. We need to stick to our immediate households. As we face the second wave and work to flatten the next curve, each of us needs to be extra vigilant. We need to hunker down. We need to reduce our close contacts. As much as possible, limit the time you spend with people outside of your household. Friends, I know that this will be very, very tough. The isolation, it's difficult on all of us, and mental health has been critical during this pandemic. I know people are struggling out there. That's why it's so important to be here at CAMH today. We had a great tour this morning of these two new buildings, and what great place and great work that they do here. With the support of our government, CAMH is doing incredible things here. 235 new patient beds, a new simulation learning center, more space for programming, including fitness and arts, and a brand new emergency department entirely devoted to mental health. And my government, we're absolutely thrilled to have supported this project with over $600 million. I also want to take a moment to thank all the frontline workers, staff, and researchers at CAMH for your incredible work. What you do every day, it saves lives. And we made this investment because we believe in the incredible work happening right here at CAMH. Because mental health is as important as physical health. And I'm very proud to announce we are investing an additional $176 million this year to support the people of Ontario when it comes to mental health. That's $176 million to fix the fragmented mental health care system we inherited, to create new services and to expand existing programs. We're making targeted investments like hiring more nurse practitioners, providing more withdrawal services in rural areas, and adding 4 more inpatient beds here at CAMH. This investment is part of our historic commitment to invest $3.8 billion in mental health over 10 years. Today's investment also builds on the $26.75 million we have provided during this pandemic to expand virtual mental health services and safely resume in-person counseling services. My friends, I've stood at this podium many times to reach out to anyone who is listening, and I'll say it again. If you need help, if you need someone to talk to, please reach out to one of these services. That goes for our frontline healthcare workers, first responders, and veterans as well. You're not alone. We all have a responsibility to look after each other, and together we will get through this. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Tibollo.
Thank you, Premier Ford and Dr. Zahn. It's great to be here during Mental Illness Awareness Week to mark much-needed investments in the future of Ontario's mental health and addiction system. The $176 million we're announcing today will fill urgent gaps in care across Ontario. It will see the creation of new supports and the expansion of programs in several priority areas. C'est formidable d'être ici pendant la semaine de sensibilisation aux maladies mentales pour souligner les investissements indispensables dans l'avenir du système de santé mentale et de lutte contre les dépendances de l'Ontario. Les 166 millions de dollars que nous annonçons aujourd'hui permettront de combler des lacunes urgentes en matière de soins dans tout l'Ontario, de créer de nouveaux soutiens et d'élargir les programmes dans plusieurs domaines prioritaires. Over $15 million will be focused on delivering community and residential addiction services to help those who are struggling. This investment also includes the additional $3.25 million to help provide mental health supports for post-secondary students we announced yesterday. We're also enhancing access to nurse practitioners for people who are experiencing withdrawals from substance use in Ontario's residential withdrawal management, also known as detox facilities. We're also investing in day and evening care to increase access to intensive non-residential addictions and substance use treatment services for both youth and adults. We're also expanding access to community withdrawal management services for hard-to-service clients, such as Ontarians in rural communities. And we're investing in-home and mobile withdrawal management services so that Ontarians have access to the services that they need when and where they need them. Each one of these investments fall under the umbrella of Roadmap to Wellness, our plan to invest $3.8 billion over 10 years to build Ontario's mental health and addiction system. Our government knows that you simply can't have health without mental health. And by making these investments today, we're building our system for the future so that every Ontarian can be fully supported in their journey toward mental wellness. I will now invite Minister Elliott to say a few words. Thank you.
Thank you, Minister Tibollo, and good afternoon, everyone. I want to start by thanking the staff and leadership at KMH for your incredible and ongoing efforts in the face of the COVID-19 outbreak. These are unprecedented times for us all, but when this virus swept across the world, our doctors, nurses, and healthcare workers really showed us the depth of their compassion and their commitment to protecting and keeping us safe. I want to extend my deepest appreciation to all the staff, physicians, nurses, and volunteers for all of your efforts. Thank you. We know, as you certainly do know, that mental health is health. In addition to the important mental health and addictions investments we've announced here today that will enable our roadmap to provide a clear path towards easier access to higher quality care and supports in communities across the province, we are pleased to be here at KMH to celebrate the grand opening of the third phase of this historic redevelopment project. The McCain Complex Care and Recovery Building and the Crisis and Critical Care Building will transform mental health care in the province. Patients will have access to an emergency department devoted to mental health, with spaces that support recovery and promote community integration for patients in a connected and coordinated system of care. These new buildings will help clients of KMH access the right care for their needs when they need it. So I do want to congratulate the hospital's executive team and staff, the community and its leaders, and everyone who has come together to make this project a reality. Our government is proud to invest $633 million to fund these 2 new hospital buildings at KMH. But I also want to recognize the McCain family for their generous contribution to the hospital, as well as the many other generous donors. This project is truly impressive and demonstrates what we can achieve when government, hospitals, and community partners work together. We made a commitment to end hallway health care and build a comprehensive and connected mental health and addiction system that works for all Ontarians. Investing in necessary capital projects for our health and mental health and addiction sector is a critical component of our strategy. New investments will address growing demand for healthcare services and support new and innovative models of care. With the COVID-19 outbreak in Ontario, it is more apparent than ever that we need to ensure we have the capacity to safely address the healthcare needs of the people of Ontario, and that includes the need for mental health and addiction services. During these unprecedented times, our government is committed more than ever to protecting the health and well-being of all Ontarians. Thank you.
We'll go to the phone line for questions. Just a reminder that it's one question and one follow-up, please.
First question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi, Laura.
Hi, Premier. I'm just wondering about your help for businesses. I know that the small business minister announced some measures today. I'm wondering if you're planning on announcing anything more in terms of financial compensation for businesses as Quebec has done, or if you are looking at providing rent subsidies, loans, a permanent eviction ban, something potentially that stakeholders would see as a bit meatier than what you announced today.
Yeah, no, I understand, Laura, what you're saying. Right now, we're consulting with businesses and with our Minister of Finance and Economic Development, Vic Fideli, and we'll be coming out and saying more about this over the next week or so.
Follow-up.
Okay, and regarding Toronto's calls to close bars, restaurants, indoors, and gyms for at least 28 days, you've talked repeatedly about the need to see data and evidence.
Yeah.
Toronto's public health officer has said that 44% of community outbreaks are tied to these venues. So, and they say that's about 20 businesses that are the result of that. So I'm just wondering, they think that they have provided the data. What is your response to that? And what about that figure is not enough for you?
Well, I always go and I trust our Chief Medical Officer and our command table, so I'll sit down and speak to them. And you mentioned 20 businesses. So based on 20 businesses, there's 7,600 small restaurant owners. Am I going to destroy 7,600 businesses over 20 people? We're going to target the people that are bad actors out there. We're going to make sure the Minister of Labour is in there, putting down some pretty heavy fines, and we put in the protocols to keep these places open. And I believe the vast majority of them, out of the 7,600 businesses, just think of that. Even if you have 10 people or even less than 10 people, I can't put 76,000 people in their livelihoods and just shut them down. They're barely holding on by their fingernails right now. And we're here, talk about mental health. Do you know how many issues on mental health that would create as well? And you gotta have a balancing act. And that, I'm a strong believer in what CAMH is doing. And I want to thank again Dr. Zahn for the incredible work and our team for doing some amazing work. And people are struggling right now, and you see a lot of people with mental health challenges right now. We need to be there for them, and that would be absolutely devastating to people if we did this to them.
Next question.
Next question comes from Matthew Bingley from Global News. Please go ahead.
Hi, Matthew.
Matthew, you there? We'll go to the next question.
Next question comes from Cynthia.
Oh, hello, sorry.
Oh, sorry. Go ahead, Matthew.
Oh, hi, sorry, mute. My question is just following up on what Laura was asking. Yeah. Just with those community spread figures that was released from Toronto, with the 44% of those between the period of 28 to the 26th of September. I'm just wondering if you have seen for the following week any data that actually does back up what you're asserting is only a few bad actors. Has there been any more of that evidence that the city has actually provided you to maybe help you with this decision that is a little bit more recent than the end of September?
Well, myself, I have not seen it personally, but I will sit down and ask to see it. But again, I just go back to everyone just following the proper protocols, and I think the restaurant owners are doing a fine job. There are some bad actors, but we can't paint them all with a broad brush, and we just can't shut down people's livelihoods that quickly with a broad brush. And I used the construction trade yesterday as an example. If we would have done that, that's 500,000 people that wouldn't have had a job. That, in essence, people wouldn't be moving into their condos and their houses. So we have to be very, very careful when we're messing with people's lives like this. And I don't take that lightly. When there's 40 out of 7,600, you know, you ask the people out there, what are they thinking? I know what they're thinking watching this television. You can't destroy 7,600 businesses. Multiply that by 10, over 40 bad actors.
Follow up?
Yeah, my next question is, due to growing concerns from doctors and advocates about who have been dealing with the homeless population, with the change in how testing is done with appointments, they're pointing out that this vulnerable segment of the population does not have access to phones or the internet to actually make these appointments, and they're worried that these people are going to be slipping through the cracks. So I'm just wondering what your government is doing to ensure that this doesn't happen, and how much consideration went into that particular population when this decision was made.
I think that population is critical, and that's where you see some of the COVID cases. And I'll pass this over to the Minister of Health. Thank you.
Well, of course, we want to make sure that anyone who needs a test will be tested, and so we recognize that there are some populations that would find it very difficult, including homeless people, to make an appointment to go to an assessment center. However, we still do have testing that's happening with some of our mobile testing teams. I know that they're going into shelters and other locations to speak with people who are homeless and to administer tests as needed there as well. So we have many ways that we're dealing with it. We have the pharmacies open, we have the assessment centers, we have mobile and pop-up testing available, and we also have testing available if people are receiving home and community care, that they can be tested at home or in primary care centers. So we want to make the testing available to anyone who needs it.
Next question.
Next question comes from Cynthia Mulligan at City News.
Cynthia, before you start, I want to apologize. Yesterday, I did review the tapes, and you're 100% right. I did say families, not households, so I apologize.
Oh, thank you, Premier. I appreciate that.
Thank you.
This question is for my colleague, Faiza Amin. We saw data leaked this week showing some marginalized communities in Toronto are seeing alarmingly high positivity rates. Yeah. Why isn't the province making this data available to the public? And how are you tailoring resources and support to these neighborhoods? Advocates and experts that we've spoken to says the government is failing these communities.
Well, before I pass it over to the Minister of Health, I think the contrary. When we see high numbers in these communities, we'll send the mobile testing units in, but it's also making sure that we communicate clearly with these communities. And Cynthia, I have one of those communities right in my riding that we're working with, and through public health as well. There's a public health office not too far from that community, and I'm driving through it and seeing what's going on, and where I see people, I'll chat with them at a social distance, mind you. But it's an area that we have to target, and that's what we're going to do. Really focus on the areas that are seeing the situation escalate a little bit. But I'll pass it over to the Minister of Health.
Well, we are targeting our resources to several neighborhoods that are particularly vulnerable, where there may be a number of generations living in the same household. And so it's very difficult for people to isolate if they have symptoms of COVID. But I could say that our hospitals are doing an amazing job. I know that Michael Garron Hospital has some communities in their area that they are reaching out to these communities and providing supports and doing testing in those communities as well to offer assistance. And of course, the federal government has also offered financial assistance in providing accommodation for people that are finding it very difficult to self-isolate due to their families' living arrangements. So we are paying attention to these neighborhoods, and we know that they need some extra help, which we are providing.
Follow-up?
Premier, this follow-up is for you.
Yep.
Yesterday, twice, you said that we're flattening the curve, or even just slightly, but we appear to be flattening the curve. Is it too early to make that statement, do you think? We see hospitalizations are going up. There's a concerning rise in long-term care cases. Do we need to wait for more data before making those kind of statements?
Yeah, you know something, you're right, Cynthia. You got to be very careful, but we have seen a little bit of the flattening because of the numbers that we saw, and I think we made them public as well. At this time, they were saying close to 1,000 cases, and right now we're in the 500 range, but you're right, I'm always concerned. I could say that today, over the last few days, we've seen low 600s, then we dipped into the 500s a few times, and then, you know, God forbid, over the next week we could see it jump up, and that's why I'm always up here preaching and saying just make sure we follow the guidelines and the protocols, and I think the vast majority of people understand. They've gone through war with us from the beginning. Everyone's pitching in and doing a great job, and I just want to make it through Thanksgiving. And see how the numbers are over the next week and the protocols that we have put in place. As I always say, I'm no medical expert, but it takes whatever 7 to possibly 2 weeks to see the results of the guidelines and protocols that we put in place. And let's all pray that works and we see a decline in the numbers.
Next question.
Next question comes from Haley Cooper of News Talk 1010. Please go ahead.
Hi, Haley.
Thank you. Hi, Premier. We've been speaking with restaurant and bar owners in Toronto who say immediately after Dr. Eileen de Villa made her recommendations known about closing indoor dining, business just dropped off significantly. So now they're in a position of being open, but people aren't going because of comments and requests being made publicly by medical officers of health. So my question is twofold. This does go back to consistent messaging and the livelihoods that are hanging in the balance. So what can be done here to limit this collateral damage? And when will you or Dr. Williams formally respond to Dr. Eileen de Villa's request?
Well, I can't speak for Dr. Williams, but I know he had a well over an hour conversation with Dr. de Villa, and as he always does with all the other 34 chief medical officers of health. And folks, I understand sometimes when you have the size of Ontario, 14.5 million people, and you really have 3 different levels of government, in some cases 4 being the region and municipal and provincial and then federal. I get it, honestly, I really do. Sometimes the messaging isn't as clear as it should be, and it all comes down to communicating with each other better. And I think we all need to do a better job, even myself included. Sometimes I come up here, as I did with Cynthia. You know, I misspoke one word and bang, you're off to the races. So we have to just be a lot clearer, all levels of government and all chief medical officers on the communication. And they you know, they sit down at the table and they you know, they do such a great job. And I gotta give a shout out to Dr. de Villa. She's a super hard, bright, very smart doctor and a hardworking person, and she takes it so seriously. And I understand she feels like she has the weight of the world on her shoulders. She's dealing with the largest city, a lot of complications throughout a large city of close to 3 million people. So I just we're going to work with Dr. de Villa and her team and work through this. She's a really, really good person. She really is.
Next question, and this will be the last question.
Next question comes from Lauren Pelly at CBC News. Please go ahead.
This is for the Premier and the Health Minister potentially
Yes.
as well. Just to touch on something that you began your remarks with, looking at Thanksgiving, some are quite worried that this could be a tipping point for some of the hot zones like Toronto, that this could be a super spreading event of sorts. How concerned are you about this? I mean, the messaging, as you've noted, has been sort of changing, and people are confused. How much is the government paying attention to the fact that, you know, if people are gathering and especially indoors, that there could be, you know, quite a spike in cases from this particular weekend?
Well, we're always concerned. I think I mentioned in my speech there on any civic holidays, you're concerned because people are getting together, and they're getting together in some cases with large groups and extended family, and there's a lot of, you know, contact and hugging and kissing and everything else, and we're just asking people, as hard as it is, and then when possible, please just stick with your household. As I mentioned, in our household, none of the girls, the two girls that live with me, it's just going to be them and myself and my wife. And yeah, is it tough on everyone? Sure. Is it tough on our family? Yeah, it is. But we got to do what we have to do and get over this hump of Thanksgiving and just stay diligent. And I'll pass it over to the Minister as well. Thank you.
Well, the numbers are very concerning to us, and we're watching them very carefully. And with Thanksgiving coming forward, it is another opportunity for the community spread to grow. But that's why we are asking people to please limit the size of your family gatherings to your households and to continue to follow the public health rules that we've talked about since the beginning. It's still the best way to deal with the spread of COVID, to make sure that you keep physical distances, wear a face covering in situations where you're not able to, make sure you wash your hands thoroughly, and if you're not feeling well, don't go out and see other people at all. That is the best way that we can deal with community spread. And with respect to our hospitals, we know that they are concerned about some of their capacity limits. However, we are actively working with them. We've already provided money for expansion, and we are actively involved with discussions with the Ontario Hospital Association to provide additional resources for them to deal with any increase in volumes that they might encounter.
Follow up.
Just a question from our colleagues in Ottawa. 10 long-term care homes there are experiencing COVID-19 outbreaks, 19 deaths in the past month. The Ontario Health Coalition says BC and Quebec have made changes since March, and you have put more than $500 million into long-term care. But what else is Ontario going to do to address what these families and advocates are saying, that a system-wide plan needs to be in place to deal with these outbreaks? And I should say this applies to Toronto as well, where we are seeing new long-term care homes here dealing with outbreaks and cases as well that weren't necessarily hard hit in the first round.
Yeah, I'll pass that to the Minister of Health. Thank you.
Well, first, of course, we're trying to limit community transmission, but with respect to long-term care homes, particularly in the Ottawa area, we already have 2 hospitals in providing care in 2 homes that are in outbreak, and we'll continue to do that by partnering long-term care homes with hospitals and other organizations that can come in to support them. However, the spread in long-term care homes is very small. In situations where there is an outbreak, which is just one person that has COVID, that could be a staff member, it can be a resident. In some cases, it's purely staff members, which is unfortunate. But in terms of community spread for residents, we're working very hard to keep those numbers down, and so far it's only a very small number of long-term care homes that have been affected.
Thank you.
Thank you, everyone.